I'm Dave Hammonds. I'm the theatre and QA leader in Newcastle, Nuffield. We're here today talking about the FDR cross from Fuji, which is the first one in Europe we've had the pleasure of being able to use. Our workload backs up quite a lot if we've got like 6 or 7 post-ops, because most of the stuff we do is primarily orthopaedic, so hip replacements, ankle replacements, knee replacements. So sometimes we'll have 4 beds waiting outside a little room. Just bring them in here, use the DR function on the cross, fantastic. The image quality on the cross is fantastic. It's just totally different to what we used to with previous generations of II. Sort of mostly you just sort of see the bone, the outline of the bone, and you get the contrast from the soft tissue to bone, which is great. With this we can see cortices, you can almost see cartilage outlines, perfect for what the guys do here with the joint injections, with like the steroid injections, so you know exactly where they're going. We know exactly where we're going with our stuff as well. You've got metal reduction features, which is perfect for when we're doing the big orthopaedic jobs, especially when we're doing the spine stuff, if they want to see where, so if we're doing level check for the spine, there's loads of metal work in the top, cat's paws, things for opening the wound, and normally on the other eyes it'll blow the image right out, and you'll have very low, like high contrast around the metal and low contrast around the bone where we need to really see. But so we've got metal reduction filters, all the other tech that's built into it, it just brings out exactly what we need to see perfectly. Also with like the touchscreen collimation, it's fantastic. There's no just one aperture, so we can collimate to exactly where we need to see. And it reduces dose for everything we do as well, which is, as a radiographer, it's sort of like the core tenet of what I do. It's like reduce the dose for the patient and get the best image quality possible. One of the biggest things I've had from patients saying, this doesn't look like a piece of medical equipment, it's sleek, it's different, it's not off-white, it's not that sort of obelisk block of medical equipment that people associate with stress in hospitals. The biggest thing we've had from this is the improved workflow. It really has, because it's like one radiographer can do the job of 3 now. So like for example, we had a case where we used the fluoroscopy in theatre with and I think it was an ankle replacement, and the surgeon was like, oh, I'm going to book him in for a post-op x-ray later in the department. It's like, no, there's no need, because I can just flick it from fluoroscopy to radiography mode and get that post-op x-ray in theatre, which then saves about 6 people's jobs. So it's radiographer in department doesn't need to do x-ray, 2 nurses don't have to come straight from theatre, and another set of porters don't need to come down with a bed. And it's better for patient comfort because we can do it. We can move the ankle whilst the patient's anaesthetised. And the fact that fluoroscopy and DR imaging stays in that one patient's packet in the same series of images is fantastic, because then the consultant only needs to look at a single set of images on PACS to see his full work in theatre.
My name is Adoni Fnai Cynthia. I'm a radiographer. I'm a general radiographer, and I work with Nuffield Health Hospital, Newcastle upon Tyne. The course, the image quality is really nice. I'm impressed with that. And then the software, it's really posh, I would say. And the machine itself is smart. The fact that you have a lot of features in the machine that makes it like really easier and modern. One significant thing about this course in the fluoro use is the fact that you can take x-rays while doing the fluoro. It's really amazing. I think this is the first time saying that does that. Yeah, it's spectacular, I would say.
I'm Andrew Skinner. I'm the radiology clinical team lead here at Nuffield. Across, it's very flexible. It's a good hybrid multi-use system that enables us to perform very effectively in our roles here. So we can perform good quality inpatient x-rays on patients in bed, and it's multi-use function like that. And it supports our service with the joint injection service and fluoroscopy units that we do here. So it's really useful to switch between the 2 functions, sometimes in the same case. And of course it delivers very high quality of film integrity during those exposures. It's much lower dose than our previous equipment. The screening times are much shorter, image quality is much higher, so we don't have to use as much radiation during the investigations. When the 2 units not connected by wires in the wireless system, it's very useful because the operator can have the imaging screens where they require them for guidance. Equally, the operator's got his touchscreen interface with their own system, so they don't have to be in the same position for both parties to view at the same time, so you can run off having the system as viewable to both parties regardless of what operation has been done. So potentially if we were to take this to some of the more complicated sort of arthroscopy cases, where things are hidden under scrub tables and all the rest of it, so it's really good in those sort of situations. The pedals as well, of actually having the operator being able to position those where they need them, is a great improvement, not relying on the radiographer to image every time, so it lets the operator actually control their screening requirements, which is very good. I like not having to accidentally lean on any release catches and let the tube move, so having all the touch control to lock things in position is very beneficial. It's allowed us to shorten case booking times, so we're not having to give as much time for things because the screening time is going to be shorter because of the quality of the imaging, so it's shave off a few minutes here and then, reduce that. It's allowed us to do cases that traditionally are done in a theatre setting in here, sort of like urological cases, that sort of thing. Because of the much better quality of image, we're not relying on an older fluoroscopic system which might not have been as effective or didn't have the right sort of frame rate for that sort of investigation. So it's improved in what we can do.
Fuji Sport's fantastic, absolutely fantastic. So like support from Molly's been brilliant. I say she's pretty much available whenever I'd like send her an email, give her a ring, she's on the end of the phone. But yeah, she's answered any questions I've had, and I've had some pretty sort of niche, detailed questions, and they've been able to be answered, and it's fantastic. And I get straight through to a member of Fuji's team first time. There's no going through like an engineering subcontractor or anything like that. It's like normally 3 or 4 phone calls before I get my answer, and but with Fuji, straight through, I get the answer I need, and then it's minimal downtime for our machines. I say with this, we had it 6 months, I had no downtime whatsoever on it, because any issues that have arrived, I've been able to sort out myself with guidance from Molly, and it means we've saved time for engineers to come out. There's downtime from the machine. It's always up. We're not having to use the backup IIs, we're not having to use we're not having to send patients out to other trusts, other hospitals, because we can all do it in-house. As the lead here, I've been trying to get people involved in it, and like, I've had no resistance from anybody. Everyone's dead keen to use it, because the biggest thing that my team have come back and said to me is they just like how light it is, how easy it is to use. Also, as I said, we've got a visionary suite, and the interface is exactly the same, so no one's having any issues with coming from the visionary suite to the Cross. It's just like a home from home really for them. Everyone likes to use, dead easy to use. Everyone there's not a lot to it either, if you know what I mean. It's everything's laid out very simply and easily and very user friendly. So yeah, my team really like it. They said in the future we are looking to maybe move to another one at some point.